Dr. Herbst describes functional medicine in a very simplified way, one that I think makes sense. It's the ability to optimize function. And what that means is like getting to the root cause and restoring balance. We at SALT try to blend primary care and functional medicine. We don't try, we do. We blend that. And the reason is, we recognize that these chronic conditions are actually preventable and many even reversible.
Yes.
And so I think that's one of the things that I definitely want to hammer home and make sure we talk about is the biggest contributors to these chronic conditions that we're seeing this huge increase in across our country are actually fairly controllable. So the biggest contributors are lifestyle and environmental factors. And so what does that mean? So poor diet and nutrition. So if you're focused on improving your diet, that's great, but you need to be educated in what that actually means. So high consumption of processed foods or added sugars, not going to be good. It's going to lead to increasing your likelihood of more chronic disease. Nutrient deficiencies and inflammation, but how do you know if you're deficient in nutrients? You've got to probe, you got to ask questions, you got to ask your primary, how can I test for this? How can I figure this out?
Yes.
How can I optimize that? And
be your own health advocate.
Be your own advocate. Physical inactivity, it's as simple as that. I know everybody, we're all tired, we all have lives and we're busy and whatever it may be, but sedentary lifestyles without a doubt lead to increased risk for obesity, heart disease, cancer, all of those things. Lack of movement is bad for, your poor circulation. You're going to have weak immune system, your reduced ability to fight off those things, chronic stress and mental illness. Long-term stress is going to be a high contributor to high blood pressure, to heart disease, to risk of stroke, chronic inflammation, all of these things. Now, is it easy to manage your stress? Of course not. Of course not. But again, these are preventable. These are actionable items. It's not hopeless. It's not helpless. And then the last one I'll mention is poor sleep. We talk about it all the time at SALT, and there's a ton of attention nationally about it. But like chronic issues with not getting good rest is destroying your ability to have that optimized function that we talked about. And so the things I just listed, it's not the types of things where you're like, oh my gosh, well, if I don't stand on my head, with my, left foot pointed this direction and like do this at the exact point of it's achievable. It's not something that is impossible. So again, not hopeless, not helpless. We can reverse these trends. We can make small improvements daily, weekly, monthly, that begin to reduce these horrifying statistics for our country. And I love being able to partner with people in that health journey.
Well, thank you for being with me here today. And thank you for joining us, the audience for joining us today. We love having these conversations. Please check us out on YouTube, on our social media. Shoot us your questions. Any questions you have about functional medicine or healthcare, we'll do our best to answer it and provide our unique point of view. And in the meantime, we hope you continue to live life healthy.